I want to return to the unusual situation at the glomerulus now, where we have the afferent arteriole, the glomerular capillaries, and then the efferent arteriole, which is anatomically an unusual situation. I'm going to draw all of this diagrammatically like this. This is my afferent arteriole. Then we have the capillaries in the middle, which I'm going to draw as just one stretch. And then we have the efferent arteriole on the other side. And of course, arterioles have smooth muscle in their walls, and that means they're subject to control. They can constrict or they can dilate. The capillaries don't have that option because capillaries don't have any smooth muscle in their walls. Let's look at the control of the afferent arteriole to begin with. One of the things that the afferent arteriole can do is to auto-regulate the flow of fluid through it. And one of the mechanisms by which this occurs is referred to as the myogenic mechanism. Let's imagine that the blood pressure just to the left of my afferent arteriole is more or less the same as mean arterial pressure. And that's because the renal artery comes from the aorta. The pressure in the renal artery is going to be very close to the aortic pressure, and to all intents and purposes, this is very close to mean arterial pressure. Now, the pressure in the capillaries I will call PC. And the pressure in the capillaries is one of the factors which is causing the fluid to be filtered out of the capillaries, and of course that's captured by the Bowman's capsule, and that's the basis of the ultrafiltration. Now, there's more to glomerular filtration than simply capillary pressure, but for the moment I'll ignore those other factors and we'll just think about capillary pressure as driving the fluid out. Now, if that's the case, the higher the capillary pressure, the more fluid will be filtered out, and the greater the glomerular filtration rate would be. Well, let's imagine now that mean arterial pressure were to rise. If mean arterial pressure rose, that would increase the capillary pressure as well. Now, capillary pressure would not be as high as mean arterial pressure, because pressure always drops across a resistance, and the afferent arteriole represents a resistance. So capillary pressure is lower than mean arterial pressure, but it would still tend to follow it. So if mean arterial pressure rose, capillary pressure would rise as well, and that means glomerular filtration rate would rise. Now, it turns out that mean arterial pressure can change for lots of reasons. It's regulated homeostatically by the body, but it is allowed to fluctuate. And in different types of exercise, mean arterial pressure typically rises to some extent, often quite a small extent, but it will still rise. Now imagine if you're exercising, your mean arterial pressure went up. If all else were equal, we would expect capillary pressure to rise, we would expect glomerular filtration rate to rise, and if we didn't do something about it, we might be producing excess urine. Now that's the last thing you want if you're doing some kind of sustained exercise where you're sweating, you're likely to become dehydrated. You don't really want to increase your glomerular filtration rate. Well, this is where the myogenic mechanism comes in. Because if you do have increased mean arterial pressure, then that will result in an increased flow rate within the afferent arteriole. That increased flow rate means that there's an increase in what's called shear stress on the endothelial cells of the arteriole. And shear stress is just the force that you get when something is trying to scrape past something else. This opens ion channels within the afferent arteriole cells, and the ultimate result is that the smooth muscle cells of the afferent arteriole will constrict. So the higher the flow rate going through the afferent arteriole, the more the arteriole constricts in response. This is called the myogenic mechanism. Myo refers to muscle, genic is where it's being made. So the idea is it's a mechanism inherent to the smooth muscle of the afferent arteriole wall. So the higher the flow rate through the afferent arteriole, the more vasoconstriction you get. And if you increase the vasoconstriction, that increases the resistance, and pressure drops across a resistance. So what that means is that as mean arterial pressure rises, if the arteriole constricts, then capillary pressure can be defended and kept more or less constant. The following diagram shows the effect of arterial blood pressure on flow within this particular system. Under normal circumstances, flow is equal to pressure gradient delta P divided by resistance. And this would suggest a straight line relationship. The arterial blood pressure would increase the pressure gradient, and as that rises, if resistance were to stay the same, we'd expect flow rate to rise as well, and that gives us a linear relationship. However, with the myogenic mechanism, what happens is that if the pressure goes up and the flow goes up, as a result the resistance rises as well, because the vessels constrict. And what can happen then is that the increased pressure is matched by the increased resistance and flow remains relatively stable. So without the myogenic mechanism, we might expect a simple linear relationship which would be telling us that the flow rate would increase as blood pressure increases. And for other reasons, this is going to result in an increased capillary pressure and increased glomerular filtration rate as well, things that we don't want. However, with a working myogenic mechanism, as the arterial blood pressure goes up and the flow starts to get too high through the arteriole begins to constrict, the resistance rises to match the increased blood pressure, and as a result, the flow is stabilized. So you can see that in the intermediate sort of range of normal blood pressures that we might expect, the actual flow rate is maintained remarkably stable by the myogenic mechanism. Now, at very low blood pressures, then the flow rate does begin to decline, and that's going to be a real problem for us. At very high blood pressures, the flow rate will increase. But under normal circumstances, we can go about our day-to-day lives, we can lie down, we can stand up, we can do exercise. Blood pressure can fluctuate for all of those reasons, but the flow through the kidney is maintained remarkably constant. And this is a form of auto-regulation mediated by the myogenic mechanism.